Welcome back. My name is Moira Daly. I'm in the economics department at Copenhagen Business School. I'm very lucky to sit across the hall from Dolores, one of the organizers of today. Just like the prior session, we will, we'll only have 2 talks this session. We're going to start with Klaas Nelissen from the Catholic University of Leuven. He's going to talk to us about 3 applications of digital tools. That one well. For infectious disease control. Take it away.
Okay, thanks. So if technology doesn't disappoint us, you can see my screen now, and I'll be talking about 3 applications of digital tools for infectious disease control. And my name is Klaas. I'm from Belgium. I did my PhD in predictive analytics at KU Leuven last year. And then I had the opportunity through the NeEDS program to do a research stay at the IESISA in Madrid. However, unfortunately, it got cut short due to COVID. I returned back to Belgium just 2 days before the general lockdown. And then I got the opportunity to get involved in the COVID outbreak response, kind of at least the research part of that. So I'm a data scientist from background, and I'm working with medical doctors, infectious disease specialists, and epidemiologists on COVID research. So the 3 applications I will be talking about today is an app for digital contact tracing, so to stay in on the same topic as Jonas talked about. And then I'll talk about accurate disease mapping and monitoring. And a 3rd project we're working on is on measuring transmission chains in elderly care facilities. So first of all, we built Corona Compass. The Compass is a digital contact tracing platform, which also is able to do disease mapping, and it's geolocation based. And to situate this in the general area of research on contact tracing, well, there was no, or there is barely research on digital contact tracing. However, traditional contact tracings, which is the manual process where a specialist calls you up and talks about the infectious disease you got and gives you information and follows up with your risky contacts, such as it exists for tuberculosis, for example, that already exists for a really long time. However, we should be aware that digital contact tracing will always be complementary to that process. So here at KU Leuven, we started in the middle of March with developing this app, so just before Belgium went into lockdown. And we were for a long time in the running to become the national app. So we had discussions with the government about which approach they should take. And the app is currently being tested with around 50 volunteers in Belgium. So throughout this process, we demonstrated the feasibility of a dashboard for contact tracers, which would make their work more efficient and effective. So here on the left, for example, you see a map of the city of Leuven where hotspots are indicated. So where more than 2 or more people who tested positive have been in the past 2 weeks. And on the right, you see the dashboard as it was developed by one of our business partners, where a contact tracer can select a user and then get an overview of other users this person has been in contact with, and a ranking of recently visited locations, which might require further investigation. So this is a centralized system. Everyone. So in general, we should be aware that digital contact tracing tools must make a trade-off between effectiveness and privacy. So for example, the system from China or South Korea is quite effective in contact tracing. However, it has very low privacy guarantees. The European, or at least it's being used and developed and implemented in many European countries, such as Denmark, such as Germany, and many others, is the DP3T system, which has a lot of privacy guarantees. It's Bluetooth only, decentralized, and so on. However, it might be less effective in terms of contact tracing. For example, if you have a if you have not a location-based system, you will not be able to do any hotspot detection. And as super spreaders are an issue with COVID, it might be interesting to do some hotspot detection, or at least have a contact tracing app which enables this. In any case, we think that this period, this calmer period, at least in Europe, the lower case counts offer us the opportunity to have an informed debate about these digital tools. And hopefully we can, by the end of summer, make evidence-based choices for or against one or the other tool. Because I completely agree with Jonas that there is a complete lack of empirical evidence on the effectiveness of any contact tracing tool. So when we realized that our digital solution was not going to be the national Belgian contact tracing solution, we thought, well, what can we do? And we realized that we can roll it out as a tool for epidemiological research on a local scale. So in the city of Leuven. And we can use this mobility, it tracks your location. So we can use these mobility traces to relate these patterns and other factors to your COVID risk in a kind of a citizen science project. And this is one of the things that we'll be focusing on over the summer. In general, I think we as researchers and scientists should be aware that this is a once in a lifetime opportunity, might be the wrong word, but a moment to collect data. A pandemic of this size won't come back, hopefully, at least as we learn enough to avoid it a second time. So to avoid a second blanket policy lockdown, as we all have in the past months, we need local interventions. And to be able to do that, we should map the disease accurately and monitor it as well as we can. So what we want to do is to predict the spatial spread of COVID on a micro scale, so within one municipality. In Belgium, we have 1,800 municipalities or postal codes, but 591. And using mobility data to do this mapping or this spatial spread is already an improvement over the existing methods, which are often survey-based. So if we look at this for the city of Leuven, we already had a first look. And unfortunately, this data is quite sparse, meaning that the number of cases by day is not really high enough, even in a city of Leuven, which has around 100,000 inhabitants, to be able to make predictions on a neighborhood level. So on this slide, for example, on the left, you see a chart showing on the x-axis the date, on the y-axis the number of positive cases of COVID. And you see that the highest number of cases is 29 on a certain date. On the right, you see a map of Leuven where I indicated some, it's a fake example, don't worry, some addresses of people who tested positive. And there is just not enough data on a neighborhood scale to predict, for example, well, we should do some interventions in a certain neighborhood of Leuven. And that's our second project. We're also with regards to monitoring the spread of the disease. We're also involved in a study which is using sewage sludge as an early indicator, which has been proven to be effective in other countries, for example, in Italy, in Barcelona as well, and so on. I think in the Netherlands too. But that brings me to our third project. And for our third project that we're currently working on, we'll be measuring transmission chains in elderly care facilities. This is relevant and also urgent because more than half of all deaths in Belgium happened in elderly care facilities. Older people are more sensitive and die more easily due to COVID. So we want to determine the factors that influence the severity of the spread of COVID-19 within one facility. And for that, we're using indoor location positioning systems. So it's an ultra wideband system, which is the follow-up to Bluetooth-based systems. And if we use those, you can map the distance between different people who wear such a tag quite accurately. Based on these digital sensor measurements, we'll be able to build a digital co-location social network. We'll use social network analytics And those will enable us to determine the factors that increase the risk for transmission of COVID. So we'll be able to say, well, if you are within 2 meters for this amount of time, your risk for transmission increases by this percentage, for example. We'll be able to do this because after we have implemented indoor location positioning systems, and there is an outbreak or there is someone with symptoms within the elderly care facility, we'll test all the residents and all the employees of that facility, and we'll test them on when there is the first positive case, and then again after 7 days, and hopefully if testing capacity allows, but that shouldn't be a problem as we are part of the National Reference Laboratory for COVID in Belgium 2 weeks after the first case was detected. And hopefully this will bring us insights which are not only relevant for COVID-19, but also for influenza, and maybe in the far future also for workflow efficiency within residential care facilities and so on. So this is a very short summary of the 3 applications we're currently working on of digital tools for infectious disease control. The first one was, I presented Corona Compass, which is an app for digital contact tracing. The conclusion there is that we should be very aware of the trade-off that exists between privacy and effectiveness for digital tools. The second project that we're working on is trying to map the disease and monitor it quite accurately on a better level than we're doing up to now, where we realize that this is a once-in-a-lifetime moment for data collection. And the third project I presented is on measuring transmission chains in elderly care facilities, where we'll be using new technology to hopefully get some research results faster, so we can save some lives. So that's it. The presentation is a bit shorter than the 15 minutes I was allowed to, but that leaves more time. Yeah, more time, questions and discussion. So yeah, send me an email if you want to discuss more after the presentation, or contact me on Twitter and then we can discuss. So thanks for listening, and hopefully there are many questions.
Oh, I open it up. Let's see, do we have any in the chat? No, I don't see anything in the chat. So if you have a question, feel free to speak up. And if no one has a question, maybe I'll ask one, if that's okay. About the third project, I was curious, do you have past indoor location data or no? So I was wondering, I mean, because the elderly homes are such a problem, I imagine that it's very difficult to get in there without having been checked first. So are you just going to run into another data sparsity issue with just there's not enough sick people getting into elderly homes for you even to track them?
Yeah, so there are some indoor location positioning systems within some elderly care facilities in Belgium. However, there are several problems with that. One, they delete their data, which is good. Obviously, you don't need to keep the data if it's not in a research context. And these are room-based measurements, which are already informative, but probably not enough to really identify transmission risk, or at least measure it more accurately than we already can.
Okay, does anybody else have any questions? Okay.
If there are, yeah.
Sorry, go ahead, please.
No, it's fine, it's fine.
Okay. With that, I will thank you very much, Klaas. And if anybody thinks of something that they'd like to ask, of course, they'll get in touch with you via email. Okay, our next speaker will be Giulia Carella from CARTO, and she's going to be presenting Fighting COVID-19 through Spatial Data Science and Geospatial Data. She'll have 15 minutes to speak, followed by 5 minutes of questions.
Sure, thank you very much. Can you see my screen?
I can.
So thanks a lot for inviting me. I'm Giulia Carella. I'm a data scientist at CARTO. For those of you who don't know CARTO, CARTO is a location intelligence company. We provide platform, data science services, and visualization tools for location intelligence. So going from site planning to geomarketing to optimization. Being a location intelligence company, we've also been involved in several projects using spatial data science and geospatial data to fight COVID-19. And in this presentation, I will go through some of these. So we have all seen that spatial data and spatial analytics are crucial during a pandemic like this one, and can provide a wide range of solutions for organizations, from governments to public to private companies, looking to optimize response through the different phases, from slowing the spread to slowly reopening, and then lifting all the restrictions and rebuilding readiness for the next wave or pandemic. At CARTO, we have worked on several use cases, from development of a self-assessment app to creating data portals for governments, to using human mobility data from GPS to understand changes during the different phases. And also we have worked with data partners to create specific curated data streams for COVID-19 applications. So we have already talked about self-assessment apps. At CARTO, we have built one first for the government of the Madrid region, and then for other regions as well. This app was not intended as a contact tracing app, but rather as a self-diagnosing tool. It was built in order to reduce the pressure on emergency hotlines at the very early stage of the epidemic here in Spain. Actually led to a reduction of calls to emergency numbers, which were overloaded by requests at the beginning of the epidemic here, and was used to also monitor symptoms as it provides geolocation information on the users. So the users are basically asked to sign up and answer some questions, and the app would suggest the next steps in terms of diagnosis, and the government are then able to follow how the symptoms evolve and identify eventual hotspots. We've also worked with the New York City Department of Health and Mental Hygiene to analyze changes in mobility, spending patterns, and online presence. For example, they were interested to understand how do people travel, if there are any crowds and where, or if there had been any changes in how people are spending in essential supplies stores like groceries or pharmacies. Or even if how people were responding on an online platform like social media to COVID-19 related discussions, and how these were different in different areas of the city. For example, we used data from the Metropolitan Transport Authority in New York to estimate subway stations that were at risk of overcrowding. We took this data and computed the number of enters and exits by turnstile in a 4 hours interval, and then set a threshold of 1,000 people in each time interval to decide which subway stations were at risk of overcrowding and which were not. In the map here, the red dots are those stations that are at risk of overcrowding, and the New York Health Department was able to look at this map and then filter using different criteria, for example, the number of entries, to understand which stations were needed the most an actual intervention. Another use case was using spending data from human mobility data from one of our partners, SafeGraph, to understand how changes to grocery stores have been changing compared to a baseline in January. We computed the number of unique visitors by store on a weekly basis, and we have computed the overall change compared to the baseline. So what you see here, the points are the locations of the grocery store in New York, and the color indicates if there have been any change during the epidemic. You can see that most of those experience a decrease, but some of these actually experienced an increase in the number of visits, which might indicate again a risk of overcrowding. We've also been involved with some population level modeling and analysis. In this case, we have been using community level attributes, but also mobility and epidemiological data to highlight inequalities in socioeconomic factors and delayed effects of social tracing, of social distancing. We know that population level analysis is not intended to be extrapolated to individuals and might be actually biased by unknown confounders, but still these type of analyses have been interesting for policymakers, which are actually aiming at the community level when designing policies and interventions during a crisis. The first analysis looked at how human mobility and COVID-19 cases are related in the early stage of the epidemics in Italy. And the second, in the second analysis, we looked at how changes in mobility depended on the underlying socioeconomic characteristics and epidemiological characteristics in the US by county. In the first case, we started looking at human mobility data from one of our partners, Unacast, when the first cases had been started surging in Italy and hospitals started to be overloaded by patients. Unacast is a human mobility provider that collects GPS data from mobile apps. They have not a great coverage in Italy, but still we could see some interesting patterns. For example, what you see here is the average travel distance averaged over all the provinces in Italy in the weeks before the lockdown and right after the lockdown, which happened on March the 8th. The data that we got from Unacast are the distance traveled for each province. And what you can see here is that starting from the 21st of February, when the first cases were discovered in Codogno, overall this distance traveled had been decreasing, while suddenly there had been a peak right before the lockdown, which corresponds of the fact that some information was leaked that the lockdown would have happened. So what we did was taking this information by province and first estimate the number of expected cases for each province, assuming the same incidence by age stratum as that reported in China, and then fit to the spatiotemporal model, linking the number of reported cases by province at a given time and a smooth function of the average travel distance by province lagged 12 days beforehand to take into account any delay in testing. So what you see here is that we can recover the temporal dependence that characterized the epidemics in this early stage, an exponential dependence. But more interesting, what we see is that for enough large traveled distances, we see that there is a positive correlation between the 12 days beforehand travel distance and the number of reported cases, meaning that in provinces where there had been a larger travel distance, also they experienced a larger number of reported cases. In the US, we instead looked at the relationship between human mobility and socioeconomic attributes. We know that the US is a very divided country, and we were interested to understand if the differences in human mobility changes that we were seeing using human mobility data could be related to the underlying socioeconomic characteristics. So what you see here are data from Google specifically the percentage change from a baseline in workplace mobility. And you see that this is a random subset of the US counties. For all these counties, we see that there has been a sharp decrease in the percentage change from the baseline right after the national emergency was declared. After it reaches a minimum, then it starts slowly growing again. So what we did was to divide this time period into two phases: a lockdown phase before April the 5th, and then a recovery or post-lockdown phase afterwards, and compute the overall change in workplace mobility. The two maps that you see here show the overall change in the two phases. What's interesting here is, for example, that in the first phase, we see that we see a larger drop in workplace mobility in the Northeast, especially here in the New York State, but also in the East and Central Midwest, which were hit the hardest in the early stage of the epidemic in the US. If we look at the post-lockdown phase, we see that overall mobility is growing, but there are some areas, again, the Midwest and the Southeast coast, where this is happening faster. So what we did was use a similar framework, but in this case, try to model the change in mobility for both phases as a function of socioeconomic attributes from the United States Census and some epidemiological data, namely the cumulative number of reported cases at the end of each phase. Because most of these data are highly correlated, we first run a regression analysis using a lasso regularization to select the most relevant covariates in order to ease the interpretation of the results. And then we fitted the spatial model as a function of the selected covariates and estimated the posterior probability for each of the effects related to each of the covariates. So you see here, for example, the posterior distributions for for the change in mobility in phase 1, for the cumulative number of cases, the percentage of employees working in agriculture, in offices, the average household sizes, and the household income. So if we look at the results for both phases, what we see is that overall during the lockdown phases, changes in counties that are richer, have a workforce that is typically office-based and with higher COVID-19 incidence, also showed larger changes in workplace mobility. On the other hand, if we look at the post-lockdown phase, the increase in workplace mobility has been more effective in counties with smaller household sizes, probably due to the school closures, and also larger household income. We also partner with data providers to specifically create data streams that have applications for the COVID-19 pandemic. So we created a database gathering epidemiological data from the Corona Data Scraper initiative, and then added the geographies to be consumed as part of our free offer. But we also work with the human mobility providers to define some of their products and also spending data provider like MasterCard. We also curated some data sets on restrictions on travel or public health restrictions, and worked with Spatial AI, which is a provider of sentiment data, looking at social media data. So finally, I wanted to say that CARTO is actually trying to help all the organization working with COVID-19. So we offer a free visualization software and for anyone that is interested. So if you're interested, you can go to this URL or write me directly, and we can we can discuss about this. So that's it. Thank you.
Great, thank you very much. Super interesting. I don't see any questions in the chat, so if anybody has a question, please feel free to speak. Well, as always, I always have too many questions, so if we have time, I will ask a question. When you were looking at this workplace mobility analysis, you listed some of the covariates, it's socioeconomic covariates, and from my accent, you could probably tell I'm American. So I'm curious to know whether the political orientation of the spatial area had anything to do with the mobility patterns. Was that one of your covariates that you included?
Actually, no. That's an interesting thing that we could look at. We took only census data, so mainly demographics, and business type data, so the percentage of employees in a particular industry, but we didn't look at political.
You could look at like the election. I think you can get election results down to like the, I don't know, I think the county level. And
yeah, that would be really interesting, actually. Yeah.
I think that's one of the biggest problems in the U.S. My personal opinion. Any other questions, anyone? Okay, great. This is moving quickly. Dolores, I will hand it off to you.
Yes, thank you so much. So I must say just one more word about CARTO, is that they recently got some funding from the European Union, right? Is Giulia? Maybe you can say a couple of words, because it's actually quite impressive. They are, if I'm correct, one of the two winners from this in Spain, right? So maybe you can tell us a little bit more.
Yeah. So the grant that we got from the European Union is about creating, expanding what we call a data observatory, which is our repository of geospatial data, and the way we are creating this database and making it accessible to everyone. And on top of that, we are planning to include some spatial data science tools that can ease the workflow from discovering the data, accessing the data, and then getting out some analysis, even for non-data scientists or people that are actually usually working with this kind of data. So we know that one of the biggest problems when working with geospatial data is that they are difficult to access. We have talked about that. I mean, getting your hand on human mobility data is usually difficult, and also when you get that, time passes before you can actually start working on it. So we're trying to basically remove all the waiting times, make them readily accessible, and then also having them cataloged, and also using some, including some data science tool that will allow a much easier consume.
Thank you so much. We are closing at, I would say, rounding again 10 to. If we are back at 5:02, yeah. So that gives us more than 5 minutes for a break. Is that okay?